Okay, so this is part two, where I left off earlier. We are, we're here talking about hypertension. It's asymptomatic, has no signs and symptoms, but sometimes we see, blurred vision, headache, chest pain. Obviously, you want to make sure no sodium, foods that contain sodium, like canned foods. You don't want to make sure, no canned foods, like apple canned foods, peach canned foods, no. Like we said, you always want the individual, everyone, like you want them no smoking, no alcohol, no, we don't want them to have like hypertension, cholesterol, none of that. So, you know, how do we take blood pressure if the blood pressure, you need to know, sometimes this comes up on today. You want to make sure that, you know, too small, it's going to be high, too large, it's going to be low. And if I've had for patients that do dialysis, if sometimes they'll have like an AV shunt, or they'll have like or just in general, anybody that had a hysterectomy, in like one of their arms, let's say they had it on the left arm, then you don't want to be taking the blood pressure on the left arm, you take it on the other arm. And this one does come up on ATI, beverages, alcohol, do not exercise, do not drink caffeinated beverages within 30 minutes. Right. So note to that. That's important to know. Look for the brachial artery for sure, Please make sure you know where the brachial artery is at, where your popliteal artery is at, where your pedal pulse is at. Because like they do ask where the popliteal is at, the pedal pulse, the tibula, make sure you guys know that, please. Now that would be cardio. Now we go into endocrine. Endocrine is also important to know, very, very important. Definitely need to know the difference between type 1 and type 2 diabetes. Type 1 diabetes, right? They're born with it, kids, right? It's an autoimmune response, so there's no cause for it. It's mainly seen more in childhood. That's important to know. And so now there is no insulin being produced, right? Oh, you need to know that this is a metabolic acidosis. It does show up on ATI. Type 2 diabetes is you acquire it once you're, an adult. Why? It could be because of obesity. It could be because of, eating, not sanitary, like you're eating foods that contain, a lot of cholesterol that increase your chances of having cholesterol. So now your pancreas, that secrete insulin, right? Because that's the function of the pancreas, not to create insulin anymore. So now when you eat something, that insulin is not breaking down the fat. No, yeah, the insulin is not working, right? So you have to take insulin, right? You have to take insulin now to be able to break down. Wait. Hold on. You need insulin. There are 4 different types of insulins that you guys have to know. Please make sure you guys have the med card. Make sure you know that G larges are long lasting. You never mix G large with any other insulin. Want to know your short acting, right? Intermediate, and your fast acting. It's always clear to cloudy. Clear to cloudy. I'll send that in group chat. I'm pretty sure you it's on one of the med cards. They have it like where you go, you inject air into MPH, inject air into regular insulin, you withdraw air from regular insulin, and then you withdraw air from your MPH. So make sure you guys know that. Definitely, you guys have to, by law, have to know the A1C. You want to keep it below 6.5. Hyperglycemia, you need to know 3 P's. And those show up on ATI. Metformin, you never take it MPO, you take it with food. So make sure you guys know that. Make sure you guys know the signs and symptoms for hypoglycemia. I know it doesn't state it here. I don't see it here. Oh no, it's right here. Okay. So before I go down there, this is a way to remember it. You know, childhood comes first and adulthood, but the type 1 diabetes, you have it for life. Yeah. There's no way you have your insulin dependent for life. So diabetic ketoacidosis, definitely got to make sure you guys know that. That does show up on ATI. This is when they have an abundant amount of what's it called, sugar in their body, like very, very high, like 400. Like, you know, they do have hyperglycemia. The sugar is very high. Kussmal respirations, for sure, that does show up on ATI for that. Fruity breath, that does show up on ATI. So if I were to, you know, highlight some of the stuff, do this: ketoacidosis and acidosis. Hyperglycemia above, like, I believe, like 300, 400, that's where you want to see. That's where the sugar is going to be at. It's metabolic acidosis. And because the sugar is so high, the treatment would be IV insulin. And this one too. You want to know this one? I feel like I've seen a couple. Sometimes hyperglycemia above 600. This is more severe. Definitely gotta make sure you guys know that. Long-term complication affects everything. All your important organs: kidneys, heart, retinopathy, that's stated on ATI, which can cause blindness, renal neuropathy, loss of sensation, numbness and tingling of the fingers. Make sure you guys know hyperglycemia, hypoglycemia for sure. And the ranges, right? 70 to 100. I do 70 to 100. That's how I've always done it. But here it's stated as 70 over 110. On average, on ATI, you know, they do, or what I've seen. Well, let me rephrase that. I go with 70 over 100, 70 to 100. But I mean, if you guys feel comfortable with this 70 to 110, you guys do that. It always varies. You guys notice on, you know, ATI, other resources varies, but on average, 70 to 100. Hyperglycemia, obviously high sugar, above 100. And signs and symptoms, what you guys need to know is this 3 P's. The way I remember polyphagia, because of hunger, is it has G in it. Hunger, I don't know, polyphagia. I don't know. It sounds like you're hungry. I don't know. I'm sorry. But definitely those P's. Fruity breath, for sure, pops up on ATI. Kussmal respirations. What else? You're very hot, for sure. You know, like, side note, during times of sepsis, stress, or sickness, you want to make sure you increase. So during times of sepsis, stress, sickness, you want to increase your insulin and your prednisone, which is your your steroid. That does show up on ATI. That's important to know. That's a side note. And for if you're taking prednisone, prednisone is an important medication. You guys have to know prednisone. Prednisone is one of those medications that you have to know because it comes up a lot. Like you give it for it's an anti-inflammatory, so you give it for patients that have asthma, patients that have lupus, patients that have what do you call it? Snaps, I forgot. But it's used a lot, right? And so it does. You need to know it. There's a flashcard from this nursing making, and you have to know it. You need to know like causes osteoporosis, cataract, sepsis, hyperglycemia. So yeah, so make sure you guys know that. So always increase it, right? During times of sepsis, stress, hypoglycemia. So want to make sure you know cool, clammy skin, diurisis, confusion, right? And it's more dangerous because it can lead to coma. So brain death. So if this were like on one of like the things like where let's say who would you see first? You would see somebody that has hypoglycemia, headache, shakiness, this kind of on ETI. If they're, you know how sometimes they're difficult to arouse, you obviously you want to increase the blood sugar. So we give them insulin. No, we give them we give them a carbohydrate. This you got to make sure you know this. 15 grams of carbohydrate, juice. I believe on ATI it's stated like juice it's like 4 ounces, milk is 8 ounces. So please make sure you guys know that. You always check, and you give another 15 grams of carbohydrates to increase the sugar. Glucagon is given if they are, you know, drowsy. Always want to make sure you, you know, you know that if you exercise prior to eating breakfast, you're most likely going to decrease your blood sugar. So don't do that. You know, you can give IV 50% dextrose if they're unconscious, right? So that's important to know. You know, diet, you know, complex carbohydrates. The way I think about complex carbohydrates is they're very complex. When you go to the store, you're trying to figure out which one should I get. Keto, bread, should I get wheat, bread. You know, they have a bunch of like different types of like bread that you can get. So that's how I think about complex carbohydrates. No sodium, no cholesterol foods, all that stuff you don't want, right? Thyroid disorders, definitely gotta know that one. Comes up on ATI a lot. Hyper and hypothyroidism. Okay, so one way I think about this is obviously it has to do with the thyroid, but you gotta know this Graves' disease, hyperthyroidism. You're gonna see Graves' disease. You're gonna have because it's hyper, which is a lot, right? You're gonna see increase in T3 and T4, but you're gonna see a decrease in your TSH. What's next? Right. Oh, here. You're gonna see a decrease in okay, I don't know what's going on. Sorry. You're gonna see a decrease in your TSH, but make sure you know T3, T4 are gonna be elevated. All levels, all your vital signs, all vitals are elevated because of hyper, and your hot. That's what you gotta know. So right here, I'll see right here, it shows up right here. It's important to know the T3, T4 elevated because of hyper. You need to know everything's gonna be elevated. So you're gonna have weight loss. Why? Because you're gonna have increased metabolism. You're gonna have hair loss that does show up on ATI. Hair loss, alopecia, goiter. This is their goiter. Sometimes they have a picture of this on ATI. Oh, sorry, goiter. Sorry, that's not goiter. Goiter is when you have this is your thyroid right in your neck. It's gonna be your neck is gonna be enlarged. So that's how it looks. Hot, you're gonna be hot, high temperature. That'll show up on ATI. Exothalamus will show up on ATI. Sometimes we'll picture. So your eyes are bulging, right? And all vital signs are increased, right? Your GI function is increased. Like you can have like diarrhea, hyperexcitability, and insomnia too. Can't sleep. Let me see. Life-threatening is when you have a thyroid storm. So just think of like all your vital signs are very, 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 very increased. So you want to lower all your vital signs. So you do the beta blocker, so lower your heart rate and blood pressure. The ones end in LOL. Radioactive iodine therapy. They give you this liquid that you consume, and it's like a radioactive iodine that's only focused on destroying that thyroid of T3 and T4. And it's only focused, it only attacks that part, but it doesn't attack any other organ. But after you're done with that treatment, you want to make sure you're very like, it's like taking it's like a chemo. You don't want to make sure, you want to make sure you're not around pregnant women, kids. Make sure you have your own plate. Just pretend like your body is like it's filled with blood or something, and you don't want to touch anybody, right? You want to stay in your own little room, away from people. Thyroidectomy, they can sometimes have a thyroidectomy to remove the thyroid. With thyroidectomy, you want to make sure you assess for any bleeding, any hoarseness, or airway, because we're gonna remove this. And you want to make sure you assess for any bleeding too, mainly airway. Hypothyroidism, just think about all your vitals are low. T3, T4, we're going to be low. But this one is going to be increased. But not T3, T4 can be low. And this, you gotta know, Hashimoto's disease. Then ATI. Signs and symptoms, because everything's going to be low and slow. Can't write it down here. Low and slow, low vital signs, and very slow. So you're going to have no energy, very fatigued, expression, weight gain. Why? Because you have a low metabolism, and you're going to be cold. That's the difference between both of them. Hyperthyroidism, you're going to be hot. Hypothyroidism, you're going to be cold. Amenorrhea, that does show up, so no period. Dry skin, coarse hair, and decreased everything. Everything's going to be down low, and slow. Constipation is also another one. Please make sure you know this. Life-threatening, into coma, haven't seen that on ATI. You want to give them levothyroxine. You have to know this medication for ATI. Levothyroxine is given in the morning, 3 minutes before breakfast. Takes about 3 to 4 weeks to begin. It is pregnancy safe. You never want to stop abruptly because it can cause a hypothyroidism crisis, where you can have like high blood pressure. But it does increase T3 and T4. So that way you are not fatigued, you don't have a decreased heart rate, respiration rate, and all that. So make sure you know that med. You have to know that med. It's important. You have to know parathyroid. I've seen it maybe a couple times, 4 or 5 times. If you guys have time, please go over them. But I haven't seen it as much. But I'm just gonna quickly go over it. If I were to highlight, what's important from here, I would do kidney stones. I think I've seen abdominal pain, constipation, hypoparathyroidism. And this is right here. This is where it's located. Controls the calcium in the blood. If you have hypocalcium, you're gonna have, hypoparathyroidism, you're gonna have hypocalcium. So when you have hypocalcium, you have the positive true-sus and Chavox. So positive true-sus is the carpal spasm, right? Your hand kind of like makes a little weird motion when you have the blood pressure put on. And Chavox is you have the facial muscle, so it's contraction of facial muscle. I mean, increase phosphorus. I don't know. You guys can go over it, kind of go through that stuff, but I haven't really seen it a lot on ATI, maybe a couple times, but not really. But for NCLEX, you have to know it's for NCLEX. Definitely, please make sure you guys know Cushing's, Addison's. I'll send you guys the pictures for this because I like this. It does stay the way it is, but Simple Nursing has a picture of it. It has a visual picture, so it helps you visualize it a little better. And I can send it to you guys in a bit. So please make sure you guys know this. I'll send you guys a picture because in that one's a little better. But if I were to go through here, I would do this one, truncal obesity. Truncal obesity. Please make sure it's truncal obesity, not just obesity, something obesity. It has to say truncal, like truncal. Like that's like your word right there that you have to know. Weight gain, hirsutism for sure. I believe you have to know these lab values. For Addison's, you have to know this one, hyperpigmentation of the skin. I'll send you guys a picture right now, that way you guys can see it, because you guys have to see it. And if you see it, I feel like it's gonna be more easier to memorize it, to look at it instead of like memorizing everything. So I'll send you guys that picture. Pituitary gland. So this one you have to know. You have to know. You don't have to know where it's located at for right now, and click some for sure. Make sure you study that. But for right now, you have to know the signs and symptoms. So I have a picture for this one too from Simple Nursing. I will send that to you guys right now. It's just easier if I were to send it to you guys because you guys can see the picture. Right. So I'm gonna skip through that one. This one doesn't come up. Please know your lung sounds. Wheezing. Simple Nursing does have some. Wheezing, always correlate that to asthma. Sometimes in the statement on ATI, it'll say the patient has asthma. And if you know that they have asthma, then you know it's wheezing. Stridor, make sure you know it's an airway obstruction. That is important to know. Crackles when you have pulmonary edema, right? Pneumonia, fluid in your lungs. Crackles real. So this is important. The examples like let me see. This one you have to know pleural friction, the pleura in your heart, the little sac. If you guys can look it up on YouTube if you guys have time, but there's one on the exit. No, comprehensive 8, and they go over easy. So we went over endo, cardio. Definitely want to make sure you guys we go over musculoskeletal. Let's see. Musculoskeletal. Okay, so fractures, green stick for kids. When they fall, that's important to know. Spiral, always associated with abuse. muted. Make sure you look at them, right? Oblique is across, impacted, impact, transverse, up and down. Open compound wound, increases for infection, but please make sure you know that one. In general, if you guys have a femur fracture or any femur fracture, and if you guys have petechiae, that's very important. That's bleeding, and you don't want to have petechiae, right? The bleeding from your skin. So, osteomyelitis, right? Is bacteria. It's like when you have osteomyelitis, bacteria in your bone, I believe. You want to make sure you give patient antibiotics. I might be wrong for that, but please correct me. Make sure you guys know osteomyelitis. Bone healing, haven't seen that, so please don't focus too much on that. I know you have to know dronate, the drug that ends in dronate for bones, because what happens is with dronate, if you have osteoporosis, you want to stop you want to slow down the progression of osteoclast and osteoblast. If you remember from term 1, osteoclast and osteoblast, they like one breaks down the bone, the other one forms back the bone, and they go back and forth. So you want to stop the formation of, I believe it's osteoclast. But there's a farm card, and that's important to know. You want to make sure that when you take the dronate med, you sit up for 30 minutes or you drink lots of water, because it has to go down. Otherwise, you get irritation of the esophagus, and that's not good. Make sure you know compartment syndrome, right? When you have a cast, because they can have pain, pallor, paresthesia, which is burning or tingling sensation. So if you've been pain meds, it's going to be unrelieved. You're going to have a throbbing, right, sensation. Please know your 4 Ps, because you assess for this when somebody has a cast. And if someone has a cast, you blow cool air. You don't stick a toothbrush in there to scratch anything. Treatment, place the extremity at heart level. Worst case scenario, they're gonna have face your otomy. So the otomy, not ectomy. Otomy is like an opening of. They relieve pressure. Worst case scenario, and it can lead to necrosis, because there's no blood going to a tissue, so they have a lot of oxygen, leads to necrosis, and we don't want that. Gout, you have to know gout. So always uric acid, check your uric acid, uric acid. Remember, like Mr. Morgan said, great big toe. I wouldn't focus on expected ranges too much, just know that it has to do with gout, right? It's very painful, swelling and more to the site. You want to make sure no purines, right? You want to make sure no aspirin. For sure, that one, you know that one. You don't want any red meats, any wine, right? Organ meat, seafood, no alcohol. So you want to make sure, and you're hydrated, right? Make sure you take lots of water for anybody in general. Lots of water. You want water. Everyone needs to have 2 or 3 liters of water, so that you want to make sure you do that. The 2 medications that you have to know: allopurinol prevents gout. That's how you can remember that one. And this one is for acute, when they're having that severe painful attack. You definitely want to do this. Allopurinol, it prevents the gout, right? So please make sure you go over it. But that's all I believe that's all you got to know for that. Those 2, how to differentiate them, because sometimes on ATI will ask you, like, a patient, is having an acute attack, what do you give them? And you give them this. Osteoporosis. Please make sure you DEXA scan, right? You want to use a DEXA scan to assess for any holes in the bone, any pores, right? This is what I was talking about. So you want to decrease, you want to decrease doing this right. Okay, you want to decrease the osteoclast, right? The rate of the bone reabsorption. Read this. Sorry, my head hurts. You want to just decrease the bone loss, right? Because you want to do that. You don't want to have first cardinal sign of for somebody that has osteoporosis is that kyphosis right there, the hunchback. You have to make sure you know that that's a cardinal sign. It's very important to know. They have, so the thing is here, when the patient has osteoporosis, right, they fall, right, and I think that's like the first indicator of like, okay, like why they have osteoporosis. That's how they feel like, oh, like most of, I mean, like when osteoporosis, your bones start getting fragile. They start getting brittle, little holes in them, and then over time, you know, they become brittle. And like if you're walking, let's say, and you, I don't know, if you're walking, and for some reason, you know, that one of your bones, like you can see your femur, and it has like a bunch of holes in there, you know, and one day you fall, you go to the hospital, and then you have osteoporosis. It's not that one fault that, you know, how do you have osteoporosis? It's so many factors. It's the how like over time with like limited amount of like calcium and vitamin D and you know, just being Asian woman lifestyle, that all contributes to it, and that leads to, you know, hip fractures for, especially for older adults. Always a hip. A lot of older adults have hip fractures, especially nursing homes. So it's asymptomatic until a fracture occurs. So you don't know about it until it occurs. A lot of hip fractures. So make sure you take calcium, vitamin D. Women, you know, after menopause, they have an increased risk factor. Why? Because you know, there's a decrease in estrogen at menopause causes an increase in reabsorption. That's why because of alcohol immobility, that does show up on ATI, where it's like, oh, somebody is just sitting in a chair. What are they more prone to having? And it's osteoporosis because they're not mobile. Asian women as well. That one comes up. Your eating disorder, you know, or yeah, eating disorder, bariatric surgery, celiac, where celiac you can't like absorb brown, the acronym brown. So I would write it down right here really quick. Can't write it down. Make sure brown, celiac disease, no barley, rye, oats, wheat. Corticosteroids like your prednisone, that does cause osteoporosis. So please make sure you know that. That's why I said it's very important to know that. And protopump inhibitors. So like your what's it called? So it starts with an O. It's called omeprazole. If you, we can go over it. I'll show you guys. Omeprazole has a lot of O's in it, and your bones, they look like this. Look at it. All the O's in there. Osteoporosis. Yeah, omeprazole. You know, drunk for osteoporosis. Interventions. No throw rugs. Right. Keep things nearby. It's very important. Call light within reach. Non-skid slippers, right? Cluster-free environment. Make sure you have the lights in the room, night lights before when they go to bed. vitamin D, the dronate right here. This is the medication that you gotta know for osteoporosis. Dronate, I remember it as like a drone, drones from hard bones. You know, low weight bearing exercises, so like swimming, walking, things like that. So osteoarthritis and RA, you have to know this right here. This does show up on ATI. For treatment, heat and cold, RA. For osteoporosis, it's only heat. You have to know osteoporosis, RA for sure. Please know RA because it does show up on kids for juvenile rheumatoid arthritis. And this is right here, swollen, inflamed membrane. And when that's inflamed, you're gonna get like stiffness. You're gonna get stiffness, right, lasting in the morning for like more than 1 hour. So you want to apply some heat, some warmth, redness, right? Oh, you're gonna have warmth and redness. Deformity of the fingers. Oh yeah, it happens in the fingers for sure. The toes, too, hands, fingers, wrists, neck, shoulders. But make sure you guys know that this lab alley right here, this does show up on ATI, the ESR and this C-reactive protein. It's going to be increased because there's inflammation in the body. So that's going to be increased. C-reactive and ESR. ISR. What? Increased erythrocyte sedimentation. Yeah. Yeah, because on ATI it's ES and then rate, the erythrocyte sedimentation rate. So make sure you guys know that one. That does show up on ATI. So there's no cure for this. But we do give them, you know, like low impact exercises, range of motion exercises. It's important to know. We can give them prednisone, right? Corticosteroid, prednisone, NSAIDs, DMARDs, which is your, I believe it's your dronate. No, not your dronate, sorry. I'm sorry, I forgot I said that. We can look at, okay, hold on. Sorry about that. You know what, scratch that out. I'm sorry. Environmental factors, cigarette smoking, family history, bacterial or illness can be. Right now, I wouldn't focus on this, the stages. I haven't seen that on ATI, but I would know the stuff that are highlighted here. That does show up on there from what I remember. And the heat and cold, definitely. You have to know them. For osteoarthritis is where you have that cartilage right here, and it's not there anymore to protect the bone. So now you have like the grinding of these two bones like together. Risk factors, older age, obesity for sure is number one. You know, heavy labor. If you walk a lot, if you use your knees a lot, you get rid of that like cartilage. That can also happen, and now you get like grinding of your bones right there. Can also happen in your, you know, here in between here to here. You do get stiffness in the morning, just like RA. That's you want to apply heat. You want to make sure you do analgesics, like I know NSAIDs. This is side note, but like on ATI, they'll ask you how do you wash a patient. How do you give a bed bath? And you want to make sure you go from distal to proximal because you want to return that venous, that blood venous basis. I'm not sure if I'm using the correct terminology. But the blood flow, you want to make sure you go from distal to proximal. So you bring it back, you know, it's essential to like the body, you know. That's side note, I just remembered that because of distal, proximal. Make sure you use heat. I know it doesn't show it on here, but make sure you do heat for treatment. And this one is heat and cold. Farm, please make sure you know What else we want to do? Make sure you know aspirin for Ray's syndrome. But where is it? I want to show you guys your prednisone because that's important to know. Your diuretics, please make sure you know your diuretics. Prednisone. Right here. You can see prednisone. Ends in SONE. Oh, doesn't say it on here. But you're gonna get sepsis. That leads to sickness. Hyperglycemia, important to know. Osteoporosis, it's important to know. Sepsis, decreased immunity, right? More prone to infection. You get weight gain for sure. And you get risk for cataracts. Always increase during times of sepsis, stress, or sickness. You want to make sure, I think right here, increase it during times of stress or surgery. Anything that has an S. Make sure this, you want to make sure if you're doing it through, you want to rinse your mouth, right? Just like for iron, how you want to make sure you use a straw so you don't stain your teeth. For this one, you want to make sure you wash your mouth so you prevent candida. Otherwise, you would have to take niacin and to fix that, to get rid of the candida. But, so you gotta know, please no prednisone. And that's it for today. Burns, let me go back to burns. Let's see. 151. So your burns, please know your rule of 9. You will have to know your rule of 9. The way I think about it is, I mean, your head. Here, let me show you. Okay, so the way I think about it is, your head is 9. Okay, it's 9. Its whole head is 9, right? Everything is 9, like because it's roll 9. Your arm is 9. This arm is 9. Your body, think of it as a domino. You know how a domino it has it's like this, right? Domino. You have the little liner here across, and you can have like 4 dots up here, 4 dots down here. But in our case, we would have 9. It's roll 9. So we would do 3, 4, 8. Like this. 9 up here, 9 up here. So if you think about it, your body, so it's going to be like this, right? So think about your front body like a domino. Half of this is 9. Half of this is 9. Your back, right? Split in half. 9 up here, and then 9 down here, right? So let's go back. So your face, the whole face, this whole stuff, the ball is 9. This is 9. This is 9. 9 up here, 9 down here, right? 9 down here, 9 up here. Your wee area, that's 1. Now your leg. So if you think about it, your leg, you can see my leg. Your leg, it's a little bigger than your arm, right? Bigger, right? If you take two of your arms, which are 9, if we said these are 9, if you take them, combine them together, they make one of your legs. Yeah. So your leg would be 18. Because 2 arms make 1 leg. And same for the other. This is your leg. 2 arms together make 1 leg. That's 18. On ATI though, they'll have like your leg. You know, if we said your leg is 18, right? What's the front would be 9, back would be 9. You split it in half, right? Sometimes they'll have like on ATI they'll have your leg and this is your leg. That looks so wrong, but okay. That's your leg and your shoe. But your leg, you know, it'll have like, it'll be covered like half of it in the front. So we know that the front leg is 9. Front of your leg is 9 because the back is 9 because everything makes 18. If the anterior, the front is shaded, and we know that the front is 9, what's half of 9? 4.5. So that would be 4.5. Think of your body as like little, I don't know, explain it, just like fragments, I guess, that you can divide. But in general, that's all I have for you guys for this. I mean, I know I went a little fast, but I mean, there's so much information that is given that I just, you know, there's so much information that's given that there's a limited amount of time that we have, you know, and like, please make sure you know this. Please make sure you know the respiratory acidosis. I will link it like in the, and what's it called, in the little box on YouTube for this, for the difference between respiratory acidosis, alkalosis, metabolic alkalosis, acidosis. And yeah. All right. I'm gonna stop. Okay, well, thank you. And I hope it helped, you know, at least somewhat. And tomorrow I will be going over the other part of med surg. Okay. I'll stop this.